Thank you very much for joining us. We want to appreciate that they asked the pediatricians for this opportunity to speak concerning childhood cancers. Childhood cancers, as you know, it's a major concern, and this particular month when we're celebrating the um, childhood cancer day, it's very important for parents and the caregivers to know the early signs of cancers and also to know what interventions they could do to prevent um, loss of their siblings and the children from cancers. Then they would or like to put a guide and also to let us know that childhood cancers could come in various forms and various patterns. The common types include cancers in the kidneys in children, nephroblastoma, cancers in the adults, in children like nephroblastoma in the kidneys, the neuromas, neuroblastoma. They could have retinoblastoma when it involves the eye. They could have brain tumors. They could have lymphomas, and they could also have leukemias in children. That's cancers in the blood. The very common signs that we could see among those children will start from head to toe. Now, from the head, you could have things like dizziness, they could have headaches, the individual could have raised, when the pressure in the brain is raised, they could have vomiting, they could have the eyes, they could have a loss of vision, they could have altered vision, they could have they could have difficulties with hearing, difficulties with speaking. They could have problems with their speech, problems with their hearing. They could have nosebleeds and all that when there's a tumor going on in the brain. And they could have weight loss. They could have cough, and they could have fever, generalized fever. When there's generalized fever all over the body, then one important thing is when they have a generalized lymphadenopathy, which is the small rubbery nodes seen in the neck, in the armpit, and also in the groin. Then they could also have things like swelling in the abdomen, in the neuroblastomas and in the nephroblastoma. The swelling could be one-sided and it could be the whole abdomen. They could also have reduced appetite. They'll be unable to eat very well. They could also have, there'll be weakness. There might be loss of balance, inability to walk. They easily get tired. They will feel very dizzy and all that, you know. So those are some of these very common signs. So, we always ensure that encourage our parents to be very observant so that when they notice changes in the children, they could come up with to see the caregiver, and the caregiver will be able to give the requisite advice on how they should proceed. One thing that is very important is that the care of somebody, a child that has cancer, is a marathon and it is not a dash because there are so many stages. There's a stage of the presentation, there's a stage of the investigation. Even in the investigation, there's a general investigation, there's a special investigation, there's the blood investigation, there's the radiology investigation. There's also the histopathological investigation because before an individual can be said to have a cancer, you must establish a diagnosis. In order to establish that diagnosis, either with use of a true cut biopsy or an open biopsy or incisional biopsy, or you understand, there must be we must be able to identify what actually the area of what actually is the type of the lesion or the type of the tumor that has been found. Whether they do the incisional or they do And once they have the biopsy done, the biopsy will give a guide. It will tell us the kind of tissue that is responsible for the tumor. It will tell us if the tumor is benign or is malignant. It will also tell us if the tumor is very aggressive, high grade, or is low grade, or is moderate or intermediate grade. It will also tell us what we should what we are likely to expect. Also, it will also guide us in how to plan the treatment, because the way we will treat the high-grade tumor is at variance with the way we will treat a low-grade tumor. And also, after that investigation has been established, we will now want to stage the patient. We want to know that this particular patient, this disease, it has involved the organ, part of the organ, a piece of the organ, the entire organ, or it has not involved extensively at all. Once that is done, we also want to know, is this patient what is the stage, to what extent of the body, other parts of the body, any evidence of metastasis, anything that should show that we should be bothered about, anything that we should be concerned about. The way we treat the stage will also determine is determined by the extent of spread. So we have stage 1, stage 2, the early stage. There's 3 and 4. They're high grade and high, where there's evidence of metastasis. So when there's evidence of metastasis, that one, most of them are not, the patient will have what we call the systemic signs and symptoms. There will be a marked loss of weight. There will be a whole lot of bleeding disorders. There can be low blood level. There can be inability to eat. There will be loss of balance, weakness. When there is an unintended weight loss, particularly in the children, there should also be concerned. So once that's done, they also now want to plan the treatment. At every stage of this disease, we must carry the patient along and their caregiver to explain to them that this is this particular stage and all that. And then when they see those signs, they should not just sit. Particularly things as simple as fever, when it's continuous and it doesn't stop, and it goes on and on and on, then there is something for us to be concerned about. We also want to realize that I also want to ensure that as much as possible, if the patient or the individual complains of things like stooling, inability to eat very well, there's something in the groin, something in the neck, something, you understand, then we also need to be concerned and to find out what actually is going on. So whenever the mother notices any of these things, maybe the child that doesn't have seizure before suddenly develops seizure, then they should be concerned. If a child that that is having weakness, that doesn't have weakness before, suddenly start developing severe weakness, and all initial assessments have been done, and there are no results, then that individual should be concerned. And concerning the treatment in childhood cancers, like we all know, the treatment, there are 3 or 4 types. There's the role of the surgery, there's the role of the chemotherapy, there's also a role for radiotherapy. We always advise that whenever a child is confirmed to have a cancer, the best kind of outcome the child could have is when they have the multidisciplinary treatment pattern. For the multidisciplinary treatment pattern, there are so many people that are involved. There's a role for the pediatrician, there's a role for the oncologist, there's a role for the hematologist, there's a role for the pediatric pathologist, there's a role for the pediatric surgeon, there's a role for the social worker, the psychologist, the caregiver, even the religious leader, because we realize that children that are cared for in a family and a societal setting, they do better than children that are just all alone by themselves and only their caregiver. And also, some are privileged; they have the treatment being done in patients that have that can afford out of the pocket. Others are those that have health insurance. So depending on the caliber of care that will be done, and all the important thing is that we must also be aware that there are so many side effects, and there's so many cultural practices that prevent people from seeking care. We should, as much as possible, ensure that our children, they are not exposed to such harmful practices that could trigger changes. For example, there's a particular kind of childhood cancer is one of the osteosarcoma. And that osteosarcoma, for example, there's some children that when they have, when the trigger of the thing is trauma. So, when they pull, so not every child can play contact sport. If there's anything that shows that the child may have something that suggests that they are prone to having osteosarcoma, then that individual should not have a contact sport being involved. It should not be involved in a contact sport. So essentially, I think by and large, with those kind of treatment, one of the side effects of treatment also we are supposed to be aware of is that when they are treating children, they could have severe vomiting, they could have challenges with taking their meals. They could have to be taking blood transfusions from time to time. They could have spending a lot of time out of school. They could spend enough time in hospital, and out of hospital, they might have to have operations and all that. We know that the various stages of the cancer could be stage 1, stage 2, stage 3, and stage 4. Most often than not, in stage 1 and stage 2, there's a potential for surgery to be curative. Whereas when it's stage 3, stage 4, the chances for surgery to be curative is very minimal. So we believe that I think with this, we can have a clear perspective of what this disease will entail. One thing we always encourage is that patients, parents, caregivers, particularly those that take the bath for the children, those that take them to school, those that help them with their lesson work, they should be very observant. Most often than not, all these symptoms of childhood cancers, they don't just happen suddenly. They have a gradual tendency. Gradually, they keep coming in. Gradually, they get worse. Gradually, they get worse. Gradually, they get worse. Until at some point, the thing will just be overwhelming and all that. And most of the patients that have a very high index of suspicion and always present early, they are those that normally will do well. They do better. They do much, much better than those that just do not, the wait until when the child has lost a whole lot of weight, or when the child is no longer able to tolerate orally again, or they wait until when the child is losing balance and is very, very weak. Those ones, the potential that the child will do well is very minimal. Also, in our own particular setting, I know we have a global audience, but the settings are different. In some settings where they have all the health insurance and all that, child has a potential of doing well. But when they don't have a long waiting list, children are not those that will have a long waiting list and all that, because they are growing and the disease also grows rapidly. And most of the time, even Burkitt's lymphoma, some have a doubling time within a week in their tumors. And because of that, the same way the disease grows, that's the same way they respond also to the chemo. That's why the chemos should be administered, particularly by professionals. Though there's a dearth of professionals with such skills, but there's what we call task shift that's ongoing. And we believe that with a comprehensive and multidisciplinary team, a child that has any features that look like cancer can easily be identified, and early treatment in cancer care is the key to survival. When they are exposed to early survival via early treatment, then the chances of optimal return to function, optimal return to school, ability to learn normally will be very, very, then we'll have a very good chance at that. Thank you very much.